Under Data Impact Program, we have three components. There is Public Health Bulletin, there is Data to Policy, and then there is Scientific Communication. Under Public Health Bulletin, we have training opportunities to train public health practitioners to write articles for the Uganda Public Health Bulletin. The Public Health Bulletin is the voice of the Ministry of Health on topical issues in public health. These can include public health emergencies and research in the broad area of public health. So the Public Health Bulletin or the Uganda Public Health Bulletin is a quarterly publication of Ministry of Health hosted at the National Institute of Public Health. And we train public health practitioners to write articles that can feed data-driven decision making in the area of public health, and also to inform other public health practitioners in the country and outside Uganda on topical issues of public health in Uganda. So the Public Health Bulletin serves in two areas. One, to inform other public health practitioners of important research going on in public health, but also helps to inform other public health practitioners, especially managers, to take data-driven decision making in the areas of work. So we organize online and live courses in the area of public health bulletin writing. So this bulletin is published quarterly and comes as an online publication, and you can subscribe and become a regular recipient of this bulletin by subscribing to the subscription page on the website of the National Institute of Public Health. And this information can be availed to you if you visit the National Institute of Public Health at Ministry of Health. The second component of Data Impact Program is the Data to Policy project. Under this, we train public health practitioners to write complete policy briefs for the Ministry of Health. Policy briefs are used to inform data-driven decision-making in areas of new policies, or if policies are to be revised, we write policy briefs. And these policy briefs are written by public health practitioners and presented to government through Ministry of Health, and then government either adopts or disapproves these documents, but we normally hope that the policy brief that we write will be adopted by Ministry of Health to improve services in government. And we have a training program for writing policy briefs. We have trained trainers in this area, and the components of these policy briefs are normally mainly two. We have the epidemiology component, and also we have the health economics components of these policy briefs. And then the third area of capacity building under Data Impact Program is scientific writing. Under this, we mainly have training for public health practitioners to be able to write scientific manuscripts, and also to be able to write conference abstracts. But the strength of this scientific writing training is for public health practitioners to be able to write scientific papers which are normally submitted to peer-reviewed scientific journals. And we have live workshops, and we have trained trainers who can support participants to come up with competent manuscripts that are reviewed back and forth between the author and the mentors to a point where the scientific manuscript can be submitted to peer-reviewed journals for publication. So these are three useful areas of Data Impact Program. So far, we have helped produce several scientific papers. We have helped to write several policy briefs, and we have also supported the writing of public health bulletin articles since November 2020, when Data Impact Program started running here at the National Institute of Public Health.